respond to cholera outbreak, initially you respond to Ogawa. I mean, the cholera is being caused by Ogawa, but when we are trying to do the lab surveillance or the lab test, you see that the cholera has shifted from Ogawa to Inaba. So these are some of the things that are being picked by the surveillance system. Also, it helps us in detecting changes in health practices and also surveillance helps us in evaluating prevention and control strategies, and it facilitates planning. So why are we talking of facilitating planning? We have the data. We know that we have January to December. So because of that data, we expect that there should be a dengue outbreak in December. So before we get to December, as a county or as a particular division or a particular department, then you come up with planning on how to counterattack or on how to prevent outbreak of diseases during that particular period before it reaches. So you allocate resources for ready to respond or prevent. So that's an example of outbreak detection response, which is expected. For example, we have the first case. Okay, so here, what I'm trying to show, or what we're trying to show, is the first case. When you get to miss the first case and you have delays, then you are expecting to get more cases you expect to get more cases of that particular disease. But if your surveillance systems are working well, and immediately a first case is noted, you detect it and collect samples whereby you do the confirmation, and within a period of, let's say, 14 days, you know that we have this outbreak, then it gives you an early opportunity for you to come up with prevention measures. So currently, the WHO have gone further and say that the time before you detect a case should be within 7 days. So after you have detected the case, you need to report within 24 hours. So when you report within 24 hours, the next 7 days, you are supposed to come up with response measures or control measures. So the red one, if we have delays, the red one can imply the number of cases that are being generated during that particular time after we have identified the first case. So with our case definition, our disease surveillance was optimum. That means we get an opportunity to prevent the yellow one. It's additional cases which will be we expected to be generated by the red cases. So if we take our actions early enough, that means the yellow ones will be prevented. Why? Why are we saying that it will be prevented? Because our surveillance systems have picked up the case and prevention and intervention measures. So, these are the basic ingredients for surveillance. So, first of all, we have said about the issues of ongoing systematic. So, surveillance somehow is something which is cumbersome, tiresome. So, we need to have some ingredients for you to do a good surveillance system. First of all, in these ingredients is that we should have a good network of motivated people, because surveillance is an ongoing thing. So we need a good network of motivated people. Then we need to have clear case definitions and reporting mechanisms. Like when we get a case, who should we report to? Or how is the reporting system? Also, we should have efficient communication systems, because if we have, like now for most of our departments, we work on silos. So that's why we come up with the One Health approach, whereby we bring out issues of effective communication. In case you have an outbreak that is related to zoonotic disease, you can easily communicate to the human animal health department. So effective communication, it's also another key ingredient for surveillance. Then the basic but sound epidemiology. You should have basic but sound epidemiology, like the issues of doing the descriptive analysis. It's very important, because from that's when you can be able to know to come up with to do the data analysis. And then there is also lab support, because surveillance cannot work in isolation. You need to have the lab. So once you detect a case, you need to collect samples and take it for lab for testing. So the turnaround time, the availability the availability of equipment for testing, all these are needed for us to have a robust surveillance system in a region or in a country. Then they should also have good feedback and rapid response. Why are we talking of good feedback? It's because if we collect data, or if I tell you that we are suspecting that we have a cholera outbreak, then we collect the samples, but we don't give you back the report that the samples that we collected, they were negative. This person who has collected that data, or who has notified, or who has detected the case, they will be demoralized. Why should they be demoralized? Simply because they were expecting to know if this case met the case definition or not. So feedback, it's really important for us to have a robust surveillance system. Then the issues of rapid response. As I've said it, currently the WHO is emphasizing on 717. So the 717, it's whereby the rapid response come in. So generally or overall, is that surveillance is a backbone of disease control. So what are these types of surveillance that we have? So the types of surveillance we have can be grouped as passive or active surveillance. So when we talk of passive surveillance, it's whereby the healthcare worker or the lab department initiate each disease report. For example, like currently, most of the diseases in Kenya, most of the surveillance system that we are doing in Africa and especially in Kenya, it's passive, whereby we're expecting the healthcare worker to tell us if there is any changes or any, if they're seeing a particular trend or an interesting disease condition when they are doing their daily routine work. So when we talk of passive surveillance, it's whereby the healthcare worker is the one who initiates reporting of a disease. So the other type is the active surveillance. So when we talk of active surveillance, it's whereby the public health agency or the public health surveillance officers initiate reporting of a particular disease. So they go, we can say that the surveillance officer goes to the health facility or to the community to look for cases. That's when you say that we have active surveillance. So the point to note is, for most notifiable diseases, I've said it, currently we use a passive surveillance. However, during outbreaks, when we go to the community to get more cases, that's when we do active surveillance. Additionally, we can talk of health agency solicited versus provided initiative. That's also another approach to public health surveillance. We can talk of case-based and aggregate surveillance. When we talk of case-based, we talk of individual cases that are being reported versus the several cases being reported. So on the aggregates and case-based, also we can say that surveillance can be vertical or integrated, whereby when we talk of vertical, we are only interested in one disease. But when we talk of integrated, we are trying to do surveillance for so many diseases. Then we have the syndromic versus the lab surveillance. When we talk of syndromic, we come up with like a case definitions, which we in this case definition, we have the clinical features, whereby we take active watch for these clinical features. Then if we get them, we report them. Versus the lab-based, it's whereby you have confirmed that this is disease X. So I'm reporting it because it's part of surveillance. So those are what we need to know concerning the type of surveillance. What are the dynamic visions of surveillance? So surveillance, we say it's systematic and continuous. So first of all, we need to collect and transmit data. And then when you collect that data, you need to analyze it. You provide feedback, then you make decisions. So the circle goes on and on. And all the levels within the system, they should use this information to make decisions. So in terms of cycle for public health surveillance, we have the public, we have the health providers, okay? Then we have the public health agencies. So when we talk of the public, when they visit the health facility, the healthcare provider report illness or receive feedback for any particular disease. Then if they get these reports, the health provider inform or notify the public health agency about a condition that they have identified in the public or in the community. The Public Health Agency goes further and do analysis and organization of this data, and from there they come up with feedback on the type of disease or the kind of disease that they have identified, and come up with feedback in terms of control measures, what is happening in the community. So the cycle of public health, that's how it goes. So here, what we're trying to say is, once you get information, you just need not to stay with that information, provided it's as information that is related to public health events or a public health disease that is likely to cause an outbreak. You just need not to stay with that information. Just report that to the healthcare provider or to your surveillance officer, who will do further investigations and come up with feedback and tell you if this is really a threat in the community or not. So, where can we get the surveillance data or sources of surveillance data? So, we talked of collecting of information, which is continuous. So collection, when we talk of information, that's when this is data that has already been analyzed. So when we talk of where can we get the surveillance data? So surveillance data, we can just get it from the health facility that we are visiting. So in the health facility, we have the OPD registers, we have inpatient registers. So, and also the healthcare workers within that facility, they can tell you which kind of, what is the interesting thing that they're reporting or they've seen in that particular period or that particular year. Also, the other thing is you can get surveillance data or data. Another source of data is the lab. As I've said it, when you confirm a disease, when you go to the lab, you can retrieve what is the most or which diseases are mostly reported in this particular region. Also, we can get surveillance data from the community members, whereby we can see that currently we have the CHPs who report and tell you that in my community, I'm seeing a lot of people presenting with fever and cough. So also the community can act as a source of data. At the local pharmacy, the pharmacist can tell us if there is an unusual event happening or unusual increase in particular disease or condition within that particular area. Then the schools, we have seen areas like the Mukumu girls incidents. So that was just a school. So the school, it's the one that initiated that we are having a problem. We are seeing children presenting with, or we are seeing students presenting with X and Y. So that's what we, that also can be source of data. Then the media or electronic, which can be electronic or print media. Like for now, most of us use the media to get to know, to notify if there is an outbreak in particular area. So because the surveillance officers or the healthcare systems, sometimes the media are more proactive and they pick up issues faster than the healthcare workers. So media can also be a source of surveillance. There was an incident whereby a certain media talked of an increase in mortality for camels, I think. Yeah. So it was reported in the media. So after it has been reported, as a surveillance officer, you need to go to the ground and understand what causes these mortalities. So media is also a source of surveillance data. The internet, whereby we have the social media, when they talk that we are seeing a lot of people presenting with disease, such as signs and symptoms in the community. There are a lot of mortality. So if you see this information in the media, you should not give it a blind eye. As a surveillance officer, you need to go further and get to know what's really happening and do the investigation. Vital statistics in terms of deaths and births, like for the deaths, you can get to know which is the most in this particular area, what is the cause of most, which is the disease, in terms of deaths, which disease it causes more deaths in this area. Also, we have the registers, KHIS, environmental monitoring. I can talk a little on sewage. Currently, we see that countries are investing a lot in surveillance using the sewage. Like for now, AFP surveillance, we rely mostly on sewage for us to do the surveillance, and also we can use the animal health data and